So to set the stage, in 2019, the Department of Health received a CDC grant that charged us to use overdose data to drive and inform interventions. It's called the Overdose Data to Action Project. That fall, RIDOH issued a request for proposal, or RFP, for data-driven outreach work. Parent Support Network and Project Weber Renew were awarded contracts, and ACOS already had a contract with RIDOH to do similar work through our drug user health program. The project officially began in March 2020. After hearing from partners at both the Code Summit that we had last July and also through the OHHS evidence update about the importance of expanding this type of work, the contracts were significantly increased this September thanks to carry forward dollars and SOAR funding. More money has allowed agencies to diversify and expand their workforce, invest in evaluation and administrative capacity, provide more basic needs to clients, and pay for workspace and vans. All of this has been essential to the work. So the goals of the project are to use data to target outreach to specific geographic areas and to high-risk populations, respond to overdose alerts or ROARs when they occur, provide and connect folks to basic needs, harm reduction, education, supplies, treatment recovery services, and lastly, just to raise awareness about the overdose epidemic, especially in those communities most impacted. Now I will quickly highlight the three organizations that we work closely with. I want to emphasize these are not the only organizations in Rhode Island doing this type of work, but they're the three funded by this particular project. So first we have Project Weber Renew, or PWR. They've been doing this type of work since 2005. And Department of Health contracts with them to serve Providence, Pawtucket, and Central Falls areas of Rhode Island. Next, we have Parent Support Network, or PSN. They have historically focused on parent and family supports and workforce development, such as the peer training program. But they began their outreach program in 2020 with this grant, and they do outreach to the rest of the state outside of Providence, Pawtucket, and Central Falls. And then we have AIDS Care Ocean State, or ACOS. They've been doing this work since 1994. They're actually one of the first harm reduction organizations in the United States. They serve the whole state, but most of their outreach is done in core cities, and then they do a lot of home delivery to the rural areas. So all three of these organizations use a harm reduction approach. This means they essentially meet people where they're at and acknowledge that some people may not be willing to or able to stop drug use. The goal is not to get every single person into recovery or treatment, but to reduce risk, reduce suffering, keep people alive, and help make each client a little bit healthier and a little bit safer. They use a non-judgmental, peer-delivered, and client-centered approach. All services and supplies are free and anonymous, and they focus on building trust and relationships with clients over time. They also accept and acknowledge that socioeconomic and structural racism contribute to drug use. Harm reduction is an evidence-based public health approach, and we're really lucky here in Rhode Island to have so many organizations that are really good at it. So the three organizations use several models to reach people who are at risk. All three of them have brick and mortar sites where people can simply just walk in to receive services. ACOS and PWR have sites in South Providence. PSN has fixed sites in South County. And we are excited to announce that PWR is in the planning phases of fixed sites in both Pawtucket and Central Providence, which are both high-risk areas. They all conduct mobile outreach using regular walking routes and outreach by van or car. They do home-delivered services. And finally, community partnerships are a really important component of the outreach work. So the outreach teams partner with local organizations like the Health Equity Zones, the Prevention Coalitions, shelters, meal sites, and local businesses to connect with people in communities. The teams provide comprehensive services to clients. So this can include basic needs, which can be anything from a simple bottle of water to a referral to housing. Harm reduction education and supplies, so safe injection kits, fentanyl test strips, naloxone, rapid HIV and HCV testing. They do a lot of risk reduction counseling. So most of the workers are either certified peer recovery specialists or community health workers, and they have valuable lived experience they can pull from to connect with clients. They also provide connections to treatment and recovery, which includes transportation a lot of times and is really important. So how do we use data to inform the work? We have weekly meetings with the outreach team, with all outreach teams in Rhode Island. where we review the most recent data, coordinate across agencies, and the peers share with us what they see happening on the ground, which can be really valuable because this is not often reflected in our formal surveillance systems. The 48-hour overdose reports are shared weekly with the teams, and overdose heat maps are shared monthly. So I'm going to give you an example of how the data is used to inform the work. This is a sample of the most recent heat map for the city of Warwick. These maps use EMS data. The graph on the left reflects data from October 2020 to February 2021. It shows a hotspot around the Motel 6 area in Warwick. After seeing this, peers deployed services to that area, and then looking at the updated time period, which you can see on the right, the map on the right represents November to March 2021. You can see the hotspot just in that little shift of time shifted to near the Warwick Mall, which is where the Nilo Hotel is, into a residential area in central Warwick. After seeing this data last month, the peers were validated in their existing outreach to the Nilo Hotel, and they were inspired to investigate the residential hotspot in central Warwick. So you can see how valuable this type of data is in both affirming existing work and triggering new places to focus outreach. Moving to the COVID-19 response, I'm proud to say that our outreach workers and teams got very creative in their response to COVID-19. They implemented safety protocols, for example, outreach pods to keep their staff safe. They developed and promoted a COVID-19 harm reduction resource that was distributed as a flyer and poster in hotspots and is online at Prevent Overdose RI. Since people were not congregating in groups as much, they had to meet people where they were. So for example, they went to meal sites, shelters, public housing, and even grocery store parking lots. Project Weberino was able to set up a hand washing station right outside their building to bring people to them. Supplies were offered in bulk to reduce COVID exposure. We saw an increase in demand for home delivered services, which is great, and we really hope that continues. The harm reduction and outreach teams were prioritized for the COVID-19 vaccine in early 2021, and we're working now with the teams to offer rapid testing for both staff and clients. This is some content from a social media campaign that RIDOH developed over the summer. It highlighted the COVID-19 safe services and the commitment of our workforce, especially at a time that was very uncertain and challenging. I'm going to transition now to talk quickly about the 10,000 Chances Project. This was an opportunity in late 2020 to saturate our highest risk communities with over 10,000 Narcan kits. And we had this opportunity to address the recent spike in overdose deaths. Kits were purchased with CARES Act funding, and the project was a collaboration between RIDOH, BHDDH, RIDMAT, OHHS, Brown University, and URI. The state partnered with over 30 community-based organizations to distribute the kits. And what I really want to emphasize is how quickly we were able to stand up this project and get the kits out to at-risk populations. It really underscored the quality of the outreach infrastructure that we've built in Rhode Island and the engagement of the rescue work group that has been so committed to harm reduction in naloxone for really over a decade. This slide features the 13 organizations that each distributed over 500 kits. And then we also had 17 other organizations that helped with the Narcan distribution. This heat map represents about 60% of the naloxone distributed from the 10,000 Chances Project. It's by recipient zip code. And it shows us that the majority of our distribution has reached municipalities with high burden of drug overdose. So you can see Providence, Woonsocket, Pawtucket, Warwick, and Cranston. And then additionally, we've reached some of the rural hotspots, such as Westerly and some of the other beach communities. We plan to have a more complete evaluation of the project early summer, but so far we've heard overwhelmingly positive feedback from our partners on how having access to more naloxone has allowed them to reach more people and save more lives. So a quick plug, anyone can go to Prevent Overdose RI and complete a 5-minute training and have free Narcan delivered to their home. So please help us promote that. So moving forward in terms of next steps for the outreach work, We're working on developing a training guide for street outreach. That project is being led by Parent Support Network. We're really trying to improve our coordination across the state. So PWR is researching a virtual platform that all outreach workers could communicate on real time. We're also trying to do a better job of improving alignment with homeless and other outreach systems in the state. We're working with our evaluation teams to better measure success of the programs. And our peers are collecting data on when 911 was not called in an overdose and why, to give us a more complete picture of the full impact of the overdose epidemic in Rhode Island. We're collecting stories to humanize the work and demonstrate its power. We're looking to promote awareness of the services, especially home delivery. And lastly, of course, we're looking to identify sustainable funding to keep this essential work going long-term and give job security to our outreach teams.